Hello everyone. Hope you're all doing good and great. As part of this presentation, I'm going to talk about healthcare plans. In today's healthcare landscape, there are several plans to choose for either individuals or for business. However, there are two prominent healthcare plans that are available. Those are HMO and PPO. So these two plans offer different benefits and features. It is essential for individual or for business to understand the differences between HMO and PPO. Let's dive deep into these two plans and see what are the features that both these plans offer. So the first plan is health maintenance organizations, HMO. Primary care physician. While choosing primary care physician for HMO members are typically required to choose a primary care physician PCP from within the HMO's network. PCP serves as a member's main point of contact for all healthcare needs and coordinates referrals to specialists when necessary. Referral requirement. In most HMO plans, members need a referral from their PCP to see a specialist or receive certain medical services. Without a referral, services obtained outside the HMO network may not be covered by insurance plan except in emergencies. So in a nutshell, so these two are tied together. HMO members need to have a specific PCP, and in case if you need to see any specialist apart from the PCP, so the PCP has to refer the specialist. You will not have the option to go on your own. Even if you do, then you will not be covered by insurance companies. So that is the nutshell of these two features while choosing the PCP and referral requirement. And the other option we have is network restrictions. So HMO plans have a strict network restrictions, meaning that members must receive healthcare services from providers within the HMO's network to receive coverage. Out of network services are typically not covered except in emergency situations or for urgent care when traveling. So, as already talked about, HMO plans work strictly within networks, and out of networks are typically not covered, and these charges will need to be covered by the individual or business. Predictable costs. HMO plans often feature lower premiums and predictable out of pocket costs for medical services. Members pay co payments for office visits and services as outlined in the plan, rather than meeting a deductible and paying co insurance. So comparatively other plans, HMO members pay a less premium because you have a restricted network, and PCP is the one who ensures that you may need to see the either you need to see specialist or not. So it is a restricted kind of a network, so that's why your costs also may be monitored. So that's why are members are required to pay less premium compared to other plans. The other feature here is managed care. HMOs emphasize preventive care and wellness initiatives, as well as care coordination and management of chronic conditions. HMO structure aims to control costs by managing utilization, promoting cost effective care, and emphasizing preventive measures. So for HMO members, as we already discussed in this point, so HMO members will be encouraged to take preventive care and wellness initiatives. These are five main features of the HMO. Let's move on to PPO and see what are the features of PPO. PPO is nothing but a preferred provide organizations provide a choice. In case of PPO members have greater flexibility in choosing healthcare providers, including doctors, specialists, and hospitals. Members can typically visit any healthcare provider, whether in network or out of network, without a referral from a primary care physician. So, as comparatively HMO, so PPO doesn't need to have a PCP. So, PPO members can choose any doctor, including the specialist. So, there is a greater flexibility for PPO members. Out of network coverage. PPO plans offer coverage for out of network services, although at a higher cost to the member compared to in network services. Members may pay higher deductibles, co-insurance, or co-payments for service received from out of network providers. So the point here is, in case of HMO, there is no coverage for out of network, whereas in PPO, the out of network will be covered but at higher cost, and you may pay like higher deductible, higher co-insurance or co-payments. But it's basically, it suggests that if you have a choice, go for in network even in case of PPO, so that you don't need to pay higher money, higher out of your pocket. And no referral requirement. So since you don't need to have a specific PPO, PCP, you don't need to have a referral also to choose a specialist. PPO members are not required to obtain referrals from a primary care physician to see specialist or receive medical services. They have the freedom to schedule appointments with a specialist directly without going through a gatekeeping process. Cost flexibility. While PPO plans may have higher premiums compared to HMOs, they offer greater flexibility in terms of provider choice and out of network coverage. Members have the freedom to seek care from specialists or facilities outside the PPO network if they are willing to pay higher costs. So, since PPO provides the flexibility in network and out of network, and there is no restriction to a PCP, or you can choose whoever you would like to see as in case if you want to see a specialist. Hence, you will be paying higher premiums compared to HMO plans. Less managed care. PPO plans typically offer less restrictive managed care compared to HMOs, with fewer requirements for referrals and utilization management. Members have more autonomy in managing their healthcare and choosing providers based on their preference and needs. So these are the features and benefits of HMO and PPOs. Hope now you got better understanding on these two plans, HMO and PPO. Thank you for watching.